Hello and welcome to a new episode of Healthycoin TV. Currently, it is a bit quiet due to the lack of regulations. Therefore, today we want to talk about the current development of the American healthcare system and why Healthycoin is currently taking its time. In the last video, we already discussed the Clarity Act and what this means for the current consequences for our project. The American healthcare system is in a phase of profound structural tensions, rising costs, political blockades, regulatory uncertainties, and an increasing decoupling of prevention and care shape the picture. For innovative health and prevention projects like Healthycoin, this environment is crucial and at the same time challenging. Secondly, political uncertainty as an innovation break health policy in the USA is highly politicized. Reforms are regularly announced but rarely implemented consistently. Since the introduction of the Affordable Care Act, the system has formally expanded but not fundamentally modernized. Instead, there is a permanent state of uncertainty, shifting majorities in Congress, blockades between states and the federal government, and a high dependence on lobby interests. For a project like Healthycoin, which connects health, technology, token economics, and incentive systems, this means regulatory planning certainty is currently not given. A hasty launch would mean committing to conditions that could fundamentally change in the short term, with potentially significant legal and economic risks. Third, regulation, between protection and standstill. Another central factor is the regulatory landscape. Health-related innovations are subject to strict scrutiny in the US, especially when they involve behavior change, data processing, or financial incentives. Institutions like the Food and Drug Administration act cautiously from a consumer protection perspective, but are structurally not designed for dynamic Web3, move-to-earn, or prevention models. Healthycoin consciously does not operate within the classic medtech or pharmaceutical segment, but is regularly categorized in regulatory gray areas because health, data, and incentive mechanisms are interconnected. In the current political climate, there is a lack of clear guidelines on how such hybrid models should be legally classified. An official launch under these conditions would not be responsible, neither for users nor for partners or investors. Fourth, prevention is politically demanded, but not structurally enabled. A paradoxical element of the US healthcare system is the discrepancy between rhetoric and reality. Prevention is often emphasized politically, but in practice, it is hardly reimbursed or integrated. Insurance models reward treatment, not avoidance. Lifestyle improvements reduce costs in the long term, but do not generate clearly attributable returns for individual actors in the short term. Healthycoin addresses this issue. Movement, activity, and healthy routines should be rewarded. However, as long as the healthcare system itself does not provide reliable interfaces for such models, there is a risk that innovation remains isolated or is misclassified. Therefore, Healthycoin pursues an approach of system compatibility rather than system confrontation, which inevitably requires time. Fifth, macroeconomic constraints exacerbate the reform backlog. Macroeconomic factors come into play. Rising national debt, inflationary pressure, high interest rates, and increasing burdens on public budgets. Health budgets are under pressure to cut costs, while demand is simultaneously rising. In such an environment, long-term prevention innovations face significant political challenges, even if they would be economically sensible. For Healthycoin, this means a launch in an environment where political actors are primarily focused on cost control and crisis management would push the project into a defensive position. Instead, a conscious wait is in place for a time when prevention is understood not only morally but also structurally as a solution. Sixth, temporal delay as strategic responsibility. From Healthycoin's perspective, the previous restraint is not a sign of weakness, but of responsibility. A project that connects health with financial incentives in the long term must be legally sound, socially integrable, and systemically compatible. The current state of the American healthcare system only partially meets these requirements. Instead of seeking short-term attention, Healthycoin focuses on sustainable preparation, analyzing regulatory developments, building international comparative models, achieving technological maturity, and establishing a clear ethical positioning. The official launch should not occur against a dysfunctional system, but into an emerging environment where prevention, personal responsibility, and digital innovation can finally come together. And finally, a look ahead. Why timing is crucial. The structural problems of the US healthcare system are now unmistakable. This is precisely where the pressure for reform arises in the medium term, necessitating new models. Healthycoin does not see itself as a short-term reaction to political trends, but as a long-term infrastructure for a healthier, more self-determined society. The delayed launch is therefore not a postponement, but a positioning. Healthycoin is not waiting for perfection, but for a moment when innovation is not hindered but needed. And that moment will come. So stay tuned, subscribe to our channel for more information on the intersection of health and finance with Healthycoin.